Hello, my name is Jeremias, and I'm joined by
Jocelyn.
Anthony.
And Emma.
We are seniors from the Northeast Metro Tech Dental Assisting Program, and as dental assistants, it is important that we educate the public on making sure your teeth last you a lifetime. Today, I'm going to be educating my patient Jocelyn on proper home care. Hi Jocelyn, how are you doing? Do you know what you are here for?
Hi, I'm doing well, thank you. And no, I'm not sure what I'm here for today.
That's okay. We're going to be discussing your home care and how we can make improvements on it.
Okay, sounds good.
Do you know what plaque is?
No, I've heard about it, but I'm not sure what it is.
That's okay. Plaque is a clear, sticky mass that forms constantly every 24 hours from the moment you put your toothbrush down. If it is not removed after a couple of days, it will turn white. You can still remove it at home with proper brushing and flossing techniques.
Okay, and where does the plaque form so I know where to focus when brushing?
That's a great question. Plaque actually forms at the gum line. It is important that we focus on this area when brushing to ensure the mass does not harden into what we call tartar or calculus. Once it turns into this, you can no longer remove it at home. Instead, you would need to come into the office to get it removed.
I see. And what will happen if I let it sit for a longer period of time?
If it remains on your teeth for a longer period of time, it can mix with the acids found in sugar and begin to form decay. It also affects your gum tissues, causing gingivitis or periodontal disease. These things can affect your mouth for the following reason. If this substance begins to irritate your gums, it can cause your gum line to push back, which can lead to gingivitis and gum recession. If gingivitis is left untreated, it could lead to periodontal disease. Periodontal disease is caused when the bone around the tooth is lost, which could cause your teeth to become loose and potentially lead to them falling out. This model demonstrates what healthy teeth look like and what a tooth affected by gingivitis or periodontal disease looks like. The right side of the tooth shows what a natural healthy tooth looks like, while the left side of the tooth shows us what our tooth looks like with gingivitis. As you can see, the area under the tooth has calculus. As we progress through the following 3 teeth, we can see how periodontal disease affects your teeth over time. As you see under each tooth, there is a buildup of calculus, and we can see how it eventually leads to gum recession. The infection progressively spreads until the tooth is no longer healthy.
If I was to get gingivitis or periodontal disease, how could I treat it?
Gingivitis is reversible, so treatment would be easier. We would focus more on brushing and flossing correctly. On the other hand, periodontal disease is irreversible, so you would have to come into the office for a treatment plan so we could discuss how we're going to treat the area. It is important that we do not reach periodontal disease as it is the #1 cause of tooth loss in America.
Thank you for answering my questions. This is informative for me, and I will make sure to focus on these things when I'm at home.
No problem. Now we're going to move on to toothbrushing and flossing techniques with Anthony and Emma.
Hello, I'm Anthony, and I'm joined by my partner Emma to teach everyone the proper brushing and flossing technique. Each of our teeth have 5 surfaces. We have the outside surface, the inside surface, the biting or chewing surface, and the 2 in-between surfaces. Brushing cleans the visible surfaces, while flossing cleans the surfaces in between the teeth. We will start by demonstrating how to properly floss our teeth. It's recommended to measure about 18 inches of floss, which is about shoulder to shoulder length. We will start with wrapping the floss around our middle finger and using our index and thumb to make sure we hug the tooth in a C shape around the tooth. Use an up and down motion along the tooth, not a sawing motion, which can cause damage to your gums. Before moving to the next surface, we want to move the floss down and away from the gums tissue in between the teeth to avoid damaging the tissue. We will proceed to the surface next to it, hugging the surface and going up and down again. We will now talk about the importance of toothbrushing. First, we must start off with the right toothbrush. We recommend using a soft bristle brush. You should switch out your brush every 3 months or if you get sick. When brushing our teeth, we focus on the outside, inside, and biting surface. What helps ensure all surfaces have been cleaned is a sequence or pattern when brushing your teeth. Always start in the same area and end in the same area to avoid missing any tooth or surfaces. When brushing, you will hold your brush at a 45-degree angle toward the gum line. Focus on 2 teeth at a time, moving the brush in small circular motions or back and forth motions. Then pull away from the gum line and proceed to the next tooth. In order to prevent recession, the last thing we do to keep our mouth clean is brush our tongue. Start at the back of the tongue and swipe down. Rinse the toothbrush and continue to brush the tongue. You can also purchase tongue scrapers if you don't want to use your toothbrush.
Hello everyone, my name is Joshua Peters.
And my name is Sadie DeRusi, and we are dental assisting students from Northeast Metro Tech. Today we are here to educate you about the different types of dental stains found in the mouth, as well as how to prevent and treat them.
Dental stains are deposits that stick to our teeth. Some can be removed and some cannot. These stains are caused by different factors. Some are caused by what we do on a daily basis, as far as our oral hygiene habits at home, as well as what we eat or drink. Other stains are caused by internal factors such as medications, restorations in the mouth. We're going to explain 2 types of stains. Surface stains are most commonly caused by poor oral hygiene, certain foods, certain beverages, and habits such as smoking, chewing tobacco, and vaping. These stains are usually superficial unless they have been on the tooth for too long. They can be removed during professional cleaning and coronal polish. As registered dental assistants, we are trained to perform the polishing part of the cleaning procedure, which effectively removes surface stains from the teeth.
This is a professional low-speed dental handpiece. Josh has attached a rubber cup polishing angle to the handpiece. In the office, we use a special paste in our rubber cup. We hold the handpiece properly and swipe the teeth from the gum line toward the biting surface, overlapping each stroke as we go to ensure all surfaces have been polished. We would then provide a full mouth rinse and end with a proper flossing of all teeth. The other type of stains we're going to show you are stains that are located inside the tooth structure. These stains are caused by certain types of medications, genetics, or metal restorations in the mouth. These stains require more involved treatments. We can provide professional whitening techniques, and if that is not effective, the patient may need crowns, bridges, veneers, or composite restorations. I will show you some examples of these. Veneers cover the front surface of the tooth only. These are strictly cosmetic. Crowns, on the other hand, are placed over the entire tooth. Bridges cover the entire surface of multiple teeth. These are all placed and prepped by the dentist. No mouth is the same and can be customized per patient. In conclusion, if you are unhappy with the appearance of stains on your teeth, discuss this with your dentist. We can provide you with the necessary treatment to have you smiling proudly again.
Hi, I am Gabriela from Northeast Metro Tech Dental Assistant, and I'm here with
Jocelyn.
and we're going to talk to you about how to care for a children's teeth. It is important that the child first experience with the oral hygiene is a positive experience. So, to clean an infant's mouth, the parent or caregiver can gently lay the child back in their arms or sit them safely in a chair. While holding the child's hand, they will gently use a clean washcloth or an infant toothbrush. In this case, we will use the finger cuff to remove plaque. Another important thing we educate parents about is the prevention of baby bottle caries. For an example, caregivers should never put their child to bed with a bottle of formula or milk. If the baby eats before bed, the mouth should be cleaned or at least rinsed before lying down to sleep. Preschool children lack the motor skills needed to brush properly. Parents must ensure that at least once a day at bedtime the child's teeth get a thorough brushing by an adult. Twice a day is best.
Also, as the child is getting comfortable with brushing, they can be encouraged to practice by tickling their teeth and gums with a toothbrush. They can do this while sitting watching TV. Even if the child chews on the brush, some plaque is being removed and they are getting used to brushing.
As children get older and can begin to read, they like to please adults and love to learn. Positive reinforcement goes a long way in when encouraging the child to brush and floss their teeth. Monitoring brushing is recommended for children up to the age of 9 to avoid issues such as cavities and gum problems.
Be sure to keep up with your child's dental appointments twice a year.
Thank you.
We hope you have a lifetime of healthy smiles.